Hello, everyone. Welcome. You are listening to another episode of the Taking Care of Your Temple podcast. I have some great guests on today who I will introduce in just a few minutes. And I want to tell you a little bit about what the podcast is for those of you who don't really, or maybe this is your first time to listen. The objective of this podcast is to help women and other people who are listening to connect with God regularly, and to do that by using His grace, strength, might, power, just wisdom, all the things, in order to improve physical, mental, emotional, and spiritual health. I have 4 principles that I suggest using in order for this to happen. The first one is to keep our focus on God. And I'm going to ask my guest, is that an easy thing to do?
Not always, no.
How come? Sounds like it would be real simple, right?
Because we're very self-focused.
Yeah. And there's lots of distractions. I mean, sometimes I feel like I'm a grasshopper, just, hopping all around everything. So constantly bring your focus back to God, bring it back. It's just a process, y'all. And if you're doing it that way, you are pretty normal. The next thing is to acknowledge that we are not enough on our own. We're not smart enough, strong enough, rich enough, pretty enough, whatever it is, to get through life without help. I mean, the older I have gotten, the easier it is for me to realize it. Yeah, that is true. I need God's help. The good news is He is always happy to give us that help if we ask Him for it. He's not going to force it on us, but if we ask, He will provide it. What I have found, though, it may not be always the help in the form that I thought it was going to be. Have y'all found that?
Yes.
That's right.
Yeah. It's like I have it all planned out. It's going to work like this. And God's like, yeah, no, we're going to do it differently. But He will provide help. The next thing is to remember it is about progress, not perfection. I think as women and as Christians, we beat ourselves up a lot. We think that, oh my gosh, I totally missed it. I'm not doing it perfectly. And God doesn't expect perfection. Thank goodness, because we would all be in big trouble.
We would be in trouble.
Yes, we would. Huge trouble. The last thing is for us to work on consciously changing our thoughts. And the reason I say that is because the messages, y'all, that we give ourselves are so amazingly important. If you give yourself a lot of negative, toxic messages and you're beating yourself up all the time, you're not going to be living the life that God wants you to live. So it's really important that we learn to see ourselves the way God sees us. And when you start thinking about that, it's almost kind of breathtaking. Mm-hmm. You see me like that? Really?
Well, and that's scripture. Scripture talks about taking every thought captive to the obedience of Christ.
Exactly.
And so we have to take our thoughts that are wrong.
Yes.
And look at them against what Scripture says so that we're feeding ourselves correct information.
Well, and I think of, and be not conformed to this world, but be transformed by the renewing of your mind. So
absolutely
not to be pushed into the world's mold. We need to be conformed to the image of His Son.
Yeah. And it's totally contrary to what the world is doing. I mean, that thinking from our perspective is so skewed that we really, I think, have to work on thinking that way. Okay. The verse for this podcast is 1 Corinthians 3:16. It's very appropriate. Do you not know that you are God's temple and that God's Spirit dwells in you? I mean, I just think that sums it up perfectly. We are His temple. We are His precious children. And that's what we need to act like. Okay. So I always start off with a quick prayer, and I'm going to go ahead and do that right now before we get started. Lord, I just thank you so much for this time today. Thank you that Kim and Suzy are here, and thank you for their knowledge and expertise that is going to be helpful to us. And I just ask that this podcast will be enlightening and helpful to people who are listening to it. Thank you so much for loving us just as we are. Amen. Amen. I do want to say to those of you who are watching and not just listening, well, and some of you who are listening, I'm doing this at home today. We're recording on a Saturday. This was the best day for Kim and Suzy. I didn't want to drive into my office. If you hear a dog barking, I apologize ahead of time. I hope that does not happen. They did it earlier, and I'm like, okay, y'all get it out of your system. Bark now.
So ours is sleeping soundly right next to us.
Well, they're sleeping, but sometimes things happen and wake them up. So we'll hope not. Okay. So my guest today, one of the people I have known since, she was born, because she's my sister, Suzy Brooks. I won't tell them how old you are, how long I've known you.
I don't mind.
Yeah. And her husband, Kim Brooks. And they have, how long have y'all been married?
37 years.
Wow. Really?
Yeah.
1986. Hopefully that adds up.
Hopefully that. I'm 37, pretty sure.
Yeah. So tell us a little bit about how you guys met, how many kids and grandkids you have, because I think that's impressive. Kind of what y'all are doing now. Just tell us some of that.
We met in college in 1983, got married in 1986, had our first daughter, Micah, in 1988, had our son, Matthew, in 1990, and then God gave us a sovereign surprise in 1999, and her name is Hannah. We have, most of our married life, we have been house parents at children's homes for kids in foster care. So we would have 8 kids in our home at a time, plus our own children.
Right.
At one point in 2002, short story, our son Matthew died of spinal meningitis.
He was 11 and a half.
He was 11.
That was so traumatic.
So that was a traumatic time. It was a real growing time for us. We were understanding the sovereignty of God and had been really learning and embracing that. And basically the couple lessons that God taught us through that is that that Pastor Richard said at his sermon, God doesn't work with us according to his power, because he had the power to raise Matthew. He works with us according to his purpose.
Yeah.
His purpose was accomplished in Matthew's death. And we've seen many, many things, gracious things that God has done through that. And
well, I remember, I want to interrupt this. There was a college guy who lived next to you all.
Yes.
Who was friends with Matthew. Matthew had been inviting to church over and over, and he never went.
Yes.
But
and
he went.
Right. He never went. He asked questions about our family a lot. And Matthew was 11. Aaron was 19. They played basketball outside and that kind of thing. Matthew had him on our family prayer list.
Yeah.
But after Matthew died, of course, that first week, you always have people in your home all week long. It was all day long. We had people in our home. And then, so Aaron was coming into our home as well. And we would look and see, and he was talking to this couple over here and they were sharing the gospel. And then the next time he was talking to this couple over here and they were sharing the gospel. So he heard the gospel all week long. We talked with him. From that point on, he was at our house for dinner almost every night. He just was coming. And about 6 months later, we gave him a Bible. He was reading the Bible and he came over and he said that he had read and understood everything and had prayed to receive Christ. So, God.
And that was just one of the many good things that God did, because you guys allowed him to work in that.
Yeah.
Which I think is so important.
So it was a hard time, but it was a much growth and much grace in that time.
Yeah.
So after that point, we were at Florida Baptist Children's Homes, where we acquired another Matthew. He came into our family. He's a big black burly Matthew. And then we were in another children's home in Oklahoma, in Edmond, where we got Bill. And when he was 15, both of the boys were 15 when we when we adopted them and they came into our lives. So now we have 2 biological daughters and we have 2 adopted sons. And between all of them, we have now 8 grandchildren.
Impressive.
Our newest one is 3 weeks old, I think, 3 or 4 weeks old.
Yeah.
So yeah.
So cute.
So
you guys stay busy. And Kim, you were in ministry off and on most of your life. Tell us some about that and like what you're doing now.
Short version is, over the years. So I will say I'm 59 and,
so am I.
Yes, for a little while. And ministry started real early as far as the pastoral ministry. I've served in as a singles minister, youth pastor, education pastor. So kind of the whole gamut. And we've kind of ebbed and flow into church ministry and childcare ministry over the years. So those have kind of been the 2 primary avenues of ministry that we've been involved in. And in fact, we were a new form of ministry when we moved back here to Florida. was when we quit the child care ministry. The Lord took us to Fort Myers, Florida, and
that's right. I forgot about that.
We worked with a house of developmentally delayed adults.
Right.
And,
so these are adults like with Down syndrome, and they can live somewhat on their own. They're in a group home, but they just need a little bit of help.
And so it was that was a sweet time. Sweet people, smiled a lot more.
Oh yeah.
Ministry than some of the things that you deal with in the childcare ministry. It's a lot more. It's getting very difficult having a house full of 8 kids that don't want to be in a place that they are. Yeah. And so that was a sweet ministry. And then we just felt the desire to be more active. That type of ministry takes you away from consistent attendance at your local church,
right?
Because you're there every other week typically, and it just makes it difficult to be plugged in, to be involved, to connect with relationships, and so we just
serve consistently in the body.
So we love ministry, but we really felt the need to be involved in our local church, and so
full time.
And so with that transition, oddly enough, I became I got my CDL and I became a truck driver. And so for about a little over 2 years, 2.5 years, I've been driving truck and doing that full time. And then we're active in our local church. And so we lead a city group every Wednesday night close by. And we, like I said, we volunteer and teach and work in our local church as well. So
cool. So what I want to talk about, one of the things you guys are doing now is something that really hit home with me. I am 66, I will say. Suzy and our birthdays are 5 days apart, but also 7 years?
I'll be 60 in May. You'll be 67?
Yeah. So about 7 years apart. So when I turned 64, I started getting bombarded with letters, with flyers, pamphlets, emails, even some texts about Medicare plans. It was overwhelming. And I just thought, when I turn 65, I'll just get the Medicare thing, see if I want to do it or not. I had no idea there were so many different plans and they all wanted me. I mean, it was just, and they were all different. And I really did not know what to do. I was like, it was kind of like, I don't know if y'all remember this because you lived in Texas for a while. When we were in Oklahoma, there was one electrical plan. That was it. OG&E, Oklahoma Gas and Electric. Moved to Texas, it's deregulated. I forget the term. And there's 200 plans. And I'm like, what? Wait, I have to pick? I don't know what all these plans are. I mean, it was really annoying. But anyway, it felt that way with Medicare. They all have these different features and I don't know which one I want. So I was really debating what to do. And I remembered, wait a minute. I'm in an organization in Waco called Women of Waco. It's a business networking. And one of the ladies there, her name was Robin Jameson. I thought, I think Robin does this. I think I remember hearing her talk about this. So I looked up on the website, called her, and yes, that is what she does. She's an insurance agent who specializes in helping people figure out Medicare. So I gave her a call. She asked me we got together, asked me all these questions, what I wanted, what I needed, what my health was like, helped me pick a plan. So much easier. So you guys are now doing the very same thing, correct?
Yeah. Mm-hmm.
Tell us how you got into that, because I don't think this is something you all had ever considered doing.
No.
So what happened?
It was a God thing.
Well, we had, I had been for a short time, I dabbled in the auto insurance. And so several years back, I jumped into auto insurance with a new company and things like that, had never had any previous experience. And that wasn't a great experience for me being a new agent. And it was a new agency. So they didn't have any business. The phones weren't ringing. So I had become licensed in that area. But no, this was brand new to us. And really the way that it happened is a Christian brother, a dear Christian friend of ours, gave me a call and said, hey, I'm starting to do this. It's a great area, a great opportunity to help people. And there's a lot of confusion. And I think you guys would do great at it. And so Suzy and I, we talked and we both ended up taking the courses and going through the licensing and got certified, got licensed,
taking the test.
Oh, that was a huge. It was huge. You know, it's like you're back in high
fun.
school with those types of tests. They're so huge. It takes so long to study for, but it was a lot of work to do it. And then in addition to just the state test, just to be certified with our insurance, we had to also go through a specialized training called AHIP. That helps you understand all of the Medicare ins and outs and the details. So you have to be certified through that as well, right? Just to kind of get a grip on all of that, because it's so much information.
Oh, there's a lot. Yeah.
A lot. Yeah.
Okay. So you guys went through the process and you are now certified in that. So
we are independent agents, which is what Robin is as well.
Right.
Yeah.
You can be a captive agent, which means you work for a specific insurance company,
a particular carrier,
Humana.
Mm-hmm.
Okay.
We are not
Blue Cross Blue Shield.
Right. We are independent agents so that we can
deal with all the
different carriers.
So we don't have one particular bent. You know, we're not going to try to push you into the one that we're carrying.
Humana or into, we can show you all the different Blue Cross Blue Shield, Humana, United Healthcare, Devoted. So
and that's what I'm kind of trying to do. There's a lot of people out there who are getting to this point. We are not alone, guys. So if they're looking for help navigating this whole craziness that's Medicare, they want to look for, say the term again, an independent
broker or independent agent, insurance agent.
Okay. Because they are going to be looking at all the plans and not just trying to steer you to the ones that they're getting money from.
Correct.
Right. And again, that gives us the ability to look at a lot of different plans. Now there are going to be some plans that you may have a tendency to gravitate towards just because of the size of the network. Right. Because the smaller your carriers, you're going to be a lot more limited on your choices as well. So there are some big boys in the market that are going to be the go-tos a lot of time because of the size, the amount of the extent of the network, the amount of doctors that they have in their network. So they're able to provide a lot more choices, perhaps some of the newer ones and smaller ones, and more stability as well.
Well, and I was going to say, and the reason to find somebody like us is because we are free of charge. So we can help you.
That's another point. Yes.
Decisions.
Yes.
And we can help you navigate which of the plans is going to fit your budget and which doctors you want to keep and which meds you're on. We will do all that research for you.
Yes.
On our own. We don't have to have you there with us. You tell us all your meds.
Yeah.
Doctors that you want. And we'll research all that and then present you with a couple of plans and say, okay, here's the best plans. Which one do you want to do? And all of that is free of charge to you,
right?
To the consumer.
And I would say this. I've kind of thought about it. Every time I go to Walmart, it's not really much better. And I'm forced, or anywhere almost now, and I'm forced to go to the self checkouts. I despise self checkouts most of the time until I look over and see the amount of line over there.
Exactly.
And again, kind of one of the things that I've seen in the whole self checkout mentality is a lot of your older people are going to the full service checkout, and the lines are really long, Yeah. And so with regards to Medicare, yes, a person can, if they're the person who likes to do the research, to do the study, and by golly, they're gonna, you can do that. You can go to Medicare.gov and you can wade through and look and research and spend all the time, and you'll be able to have the information that you need. So you can go through the self-checkout line, or you can go to an independent agent and let us do all of that for you.
Yeah. And that's a good point. When I started looking into it, though, it was so overwhelming. And I will say, I'm pretty smart. I'm pretty good at online stuff. I didn't have the time.
It's like a foreign language.
Yes.
I mean, we were taking the courses. There was times I was overwhelmed. I was like, there is no.
I remember.
I'm going to learn all of this.
She literally. There were times when I was literally pulling her along to not give up.
Like, you can do it. You can do it.
It's literally like trying to learn a foreign language because I had no, and that's part of the thing too. And I think most people have no,
what background or
like background in it or
exactly.
it's like I didn't even know what to ask.
Yeah.
It's like I just had no form of reference for it at all.
Well, and a few years ago when we worked at the place in Fort Myers, we were working with some people and they had Medicare and they had Medicaid. And at that time, I couldn't tell you the difference. I didn't know Medicare, Medicaid.
What
I didn't either. Yeah. 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 Speaking of how complicated it is, my late husband, Ed, was a dentist. And back when he was alive, I would help every now and then out in his office. And I remember this poor guy came in one time with some questions about his dental insurance. And he looked at me and he goes, I have a PhD, but it's not in insurance. And I said, nobody has a PhD in insurance.
Yeah.
I mean, you guys are working towards that, but it's really, I would not trust myself to try to figure it out on my own, because I will say, and I bet you guys have had this experience, when I sat down with Robin, she asked me things or pointed out things that I would never have even thought to ask. Like you said, you don't even know the questions. I was like, oh yeah, I guess I do want that. That sounds good. I would not have thought of it, but this is what she does. And this is what you guys do.
Right.
So I really think it's a much better experience for people going that way. So I'm kind of probably going to be going out of order. I gave you all some things, but if they want to find somebody, well, first of all, what states are you guys licensed in?
We are licensed in Oklahoma, Texas, and Florida currently.
Okay. So if people don't live in those 3 states, but they would like to contact you for questions or whatever, I mean, you could still help them because a lot of this is done online anyway, correct?
We can help them, and we can also help them. We couldn't write a plan for them.
Okay.
If they lived in Ohio.
No, I know. But if they lived in those 3 states, yeah.
Right. In these 3 states, yes, for sure.
Oh, yeah.
Even if they live in Ohio or Alaska or whatever, we can help refer them to someone like us. They can also, another way is to talk to your friends, because they will have people just like you. Robin helped me and she was amazing. Call Robin.
Yeah. Right. It's like we belong to a local church. Right. And everyone doesn't know what we do. I mean, we're in the process still of people learning that.
We're new.
But we want to, so that's a good place. People that you go to church with, if you go to church, and people that you trust, that they're going to have your best interests at heart, and not their own,
Right.
And
not just trying to get the commission.
Because a lot of the choices with the plans, again, there are plans that Medicare Advantage may be a better fit for many because of the financials that are involved. Yeah. It just so happens that the Medicare Advantage plans carry with them significantly higher commissions for agent than what someone does on original Medicare. So if it's an agent that you can't trust, or an agent that may not be looking out for your interest, they may be more apt to put you in a Medicare Advantage plan. And not in every case, that's not so in every case, but but
it can happen. Well, and y'all mentioned, you kind of alluded to it, there are a lot of people going through this because we're all getting older.
Yes.
Right. We are all moving toward that point. So if you know people who are in their late 50s or, mid to early 60s, you're right. They probably dealt with this. They either figured it out on their own, or they do have someone that they used.
So ask around. Mm-hmm.
That's one way. Is there something online? Can they just do what would they look for? Independent Medicare agent near me or something like that?
Yes. Yes.
Okay.
Right. You can, you can do that. That would probably be the best. You can Google if they have to resort to the internet, then Googling it would probably be
right. If they don't know anybody to ask. Okay.
Right.
I mean, I Google everything. Google is one of my best friends. So, Okay. All right. So we kind of talked about this. You guys went through a fairly rigorous study, examination, all this stuff to get to where you are, which I think is a good reason for someone to look for someone like you. You guys are you licensed or certified?
We're both. Yes, we have a license in the state of Florida, and Oklahoma and Texas to sell.
Okay.
And
so
Medicare typically.
But that's what I'm getting at. They need to look for somebody who is licensed, not just someone who's, hang up their shingle and saying, "Oh, I can help you with this."
Well, they wouldn't be able to.
You wouldn't be able to sell if you haven't gone through the state tests.
It's a requirement.
You can't sell it.
I didn't know that. Yeah. So it's a pretty well controlled,
regulated. Yes, very well, very well.
Yes.
Yeah.
Okay. Good deal. All right. Okay. We kind of talked about this a minute ago. How many different Medicare plans are there?
Well, I mean, hundreds, because there's different insurance companies.
Original and then Medicare.
Right. The first is original Medicare, and we can go into this a little bit. The two different choices that you have. You can keep original Medicare,
right,
which is Part A, Part B. Part A covers hospital, rehab, hospice, and home health. That's generally what Part A. It's like your hospital insurance is Part A.
Yeah.
Part B, Part A is free if you have worked for 10 years and contributed it into Social Security, or 40 quarters, as they call it. Then Part A is free.
Okay.
Part B costs right now is about $175 a month. Okay. And that's your medical insurance. So that's your doctor stuff, your preventative, outpatient, that kind of thing. So that's
just medical. That's not vision or dental, correct? Those are separate. Okay.
Correct. So original consists of A and B.
Okay.
Now
it comes with an A and B. They come with certain gaps that you need to fill.
Right.
And so because of those gaps in parts A and parts B, you need to get a med supplement,
which is like the plans A through N or whatever.
Yeah.
The most common plans are Plan G,
most popular,
and Plan N. Now those also cost per month.
Right.
$150, $175.
And that's dependent on your age, because every year, I mean, you might get a med supplement at 65, but every year that's going to increase based on your age.
Because you're getting older and the likelihood of you getting sick.
And it also depends on where you live.
Really? I didn't know that.
Yeah, part of that, what that costs is depends on where you live.
Like, are big cities more expensive?
I don't know the answer to that.
Just curious.
I don't know what qualifies to be higher geographically. I'm not really sure.
That's a great question, because now that you say that, I wonder if it has to do with accessibility. You know?
Oh, that could be. Yeah.
Sure. I don't know that one.
So we're back to original. It's Part A, Part B. Then you'll need a supplement plan, which is one of the letters.
Yeah.
You'll also need to get a Part D, which is prescription plan.
Right.
So that can vary. If you don't take a lot of meds, you can get a prescription plan that's $8 a month. If you have a lot of meds, we saw one that was $181 a month.
But some people are on a ton of medications that would be, I've heard that would be thousands of dollars.
Oh, yeah. Right. Oh, yes. So thousands and thousands. Right.
The $180 a month. It's a bargain.
Oh, yeah.
So that's another thing you have to buy. Right. And then if you want, because original Medicare does not cover at all vision, dental, or hearing. So if you want any of those, then you're buying plans.
Other plans, E and F or G or whatever. Yeah.
Original it can be pricey because you're adding up all of that stuff. So that's your original. If you don't want original, then you can go to what's called the Medicare Advantage plan. That's kind of Plan C.
And that's all of the mail that you're getting.
Yes,
you're not getting all of the mail from original Medicare.
Right, correct.
Advantage plans.
That's what they kept saying. Yeah.
And the commercials on TV, the
yes.
commercials.
Those are insurance companies, United Healthcare,
Blue Cross Blue Shield,
and all of those. And the reason you're getting all those is because they want your business. So what has happened is original Medicare, if you sign up with a Medicare Advantage, original Medicare is paying Humana $1,200 a month for your care.
And that's approximate.
That's
not
exactly. Could be that, whatever. So they're paying Humana to cover you. They have to cover you exactly how original Medicare covers you.
Okay.
So they can't give you any less coverage than original.
Okay.
They have to meet the requirements or give you more.
So Humana then can spend that money. So they can give you the perks, like they can give you a dental allowance. They can give you a vision allowance.
And that's not insurance. That's just an allowance.
They give you, like one plan that we looked at was $5,000 a year for dental, which is a really great plan.
And sometimes they put all of them in a bucket, like in one bucket, and you have that amount to use for those different things.
Okay. I have a free gym membership with mine.
Most Medicare Advantage will have a
silver sneakers,
like that.
Because they want you to stay active and So,
Right.
They'll also
To
give
keep
you,
their costs down.
sometimes
Right.
they'll give you a food card
Mhm.
that you might have
Yeah.
$200 a month to go spend at the grocery store. So
Right.
the Medicare Advantage plans will give you perks
right.
that original doesn't.
Yeah.
So let's talk real quick why you would choose original as opposed to Medicare Advantage.
Right.
Original Medicare is found in all 50 states.
Yeah.
Every hospital accepts original Medicare, every single one.
Okay. I didn't know that.
Yes. You can, if you live in Florida, but you travel a lot and you're in Colorado and you have an issue, you can use your original Medicare to get medical treatment in Colorado.
Just go to any hospital there.
Any hospital
That takes, right.
that
Okay.
takes Medicare.
Oh, okay.
And they all do.
Okay.
Most doctors take original Medicare as well. The good thing about original Medicare is that there are no pre-authorizations. So if your
Explain
doctor,
what that means.
if your doctor says, Melissa, you need a hip replacement,
And if Medicare covers it, and your doctor says it's necessary,
then you get it.
It's going to happen.
No questions asked. Nobody.
I don't have to. Yeah, I remember that from Ed being a dentist. Sometimes you had to send things in and request things for the patients and get approval.
There's
so you're
some
saying,
hoops, right?
yeah, that with Medicare, you don't have to do that.
So while it's more
Original.
expensive, it is more expensive.
Right.
But every hospital accepts it. Most doctors accept it, and there's no pre-authorizations. Okay, so that's a original Medicare.
Yeah.
Medicare Advantage is less expensive. Typically, you do not have a monthly premium, so you're not paying anything per month. Everybody still has to pay your Part B premium, which was the $175. Everybody, original Medicare, Advantage, everybody pays that. But Medicare Advantage typically rolls in your prescription into the plan, so you're not paying for a separate prescription plan. And they also roll into the plan some kind of an allotment for the vision, hearing, and dental.
Yes.
And the money card or the food card and the silver sneakers. So a lot of perks.
Right.
Now, the main problem with Medicare Advantage is that they do have pre-authorization. So it's just like your medical insurance when we were working. This is what we're all used to.
Right.
When we were working, and the doctor said, you need a hip replacement, then it had to go through all of these
because instead of going straight to the surgery, they're going to try to put you through a series of other things that are going to be more cost effective. Well, let's try this. Or
let's give you some shots, or let's go through rehab, or
physical therapy. Yeah.
All of these things before we jump into hip replacement. So you have to deal with pre-authorizations. Again, it's what we're used to with our medical insurance,
which is understandable because again, they have a certain amount and they're trying to manage that as best they can. But again, now that you have a middleman between you and your doctor, because now there's the algorithms that they're dealing with, there's the pre-authorizations that they're dealing with, and you've put someone else in between the decisions for you and your doctor. And for some, that's okay. It's not a big deal. And so again, an Advantage plan but it's something that people need to know.
Yeah. Be aware of.
To an Advantage plan, because they may be surprised by some things. And that's what we want to be sure to do as agents is we want to make sure that we're given the whole story.
Right.
That we're not trying to lean toward a certain direction. We'll give the information and let the person make the best choice for their health and for their budget.
Yes. And the other thing that as far as Medicare Advantage, not all doctors accept all Medicare Advantage plans.
Oh, correct.
So you have a doctor that you are like, I am keeping this doctor, then you're going to have more limited choices in Medicare Advantage.
Well, so you have to call their office and see, do y'all take any Medicare Advantage
that for you?
Plan?
That's what we do, because we can look on our platform on our computer. Gotcha. This doctor does not accept Humana.
Yeah.
Right. So then we could tell you, you're not going to be able to cover by Humana because your primary care doesn't. So we would have to do all that research for you. Some hospitals don't accept specific Medicare Advantage plans. So there are pros and cons to staying with original. It's more expensive, but it has more freedom.
Right.
And Medicare Advantage is less expensive. It's a little more restrictive. So it just depends on, you may want, as Kim and I talk about, we may say, boy, we would love to stay on original Medicare because we love to travel and we can do all of these things and there's no pre-authorizations, but we can't afford it.
Yeah.
That's what it comes down to. We would not be able to afford all of the different components of original Medicare. So we would choose Medicare Advantage.
Right. Because it is better than nothing.
They are really good plans. They're great.
Yes.
Medicare Advantages are great plans.
I'm very happy with mine. I remember Robin talking about this, and I think it was going to be almost $350 or $400 more for original Medicare than for my Advantage plan. And I was just like, yeah, that sounds great, but same thing, I can't afford that.
But the reality is the majority of us aren't, the high income people that can afford all that.
Well, and I think the stats are just under or pushing 50% of the population that are 65 or older. It's about 50-50 on Advantage plans and original at this point.
Well, one of the things we were kind of talked about a little bit before we started recording, my thought was, well, I'm pretty healthy, so I think an Advantage plan would be fine. And you guys are saying, well, the health may not be that big of a factor. So talk about that a little bit, please.
All right. Well, one thing is I would make sure that that most of us can't change typically, especially as we're getting to 65 and older, is can I afford it? So what does my pocket, I go into a restaurant and, I don't always, depending on the restaurant, I don't always read left to right. Sometimes I read right to left. I look at the price and then I look over and see if it's something that I want. And so again, that's kind of the same way on this, is that sometimes, or most of the time, finances is what's driving. And so
reality.
If you can afford it, then again, I would say original is probably a great choice.
Yeah.
If you have the money to spare and you can do it, stay on original because
there's no limitations on it.
And with the Advantage plans, those doctors and networks, every year, you may have your doctor the first year, but your doctor can pull out at any given time.
Yeah.
They decide they don't want to accept the plan. So if doctors are important to you, I've had this doctor for this amount of time, and by golly, I want to keep him forever, till I die. Well, your doctor's going to have the option of pulling out
every year. Yep.
Right. And,
but back to health.
Yeah.
You may be healthy.
That's right.
Today.
Right.
Yeah.
It's like you are. You're very healthy. You're active and all that. Well, you may come down with a cancer diagnosis tomorrow.
Yeah. Or be in a car wreck.
Correct. So health really isn't necessarily the question that you're considering when you're trying to figure out which plan. Well,
and to go ahead and build on that, the reason you have to think about that is back to the options. If you do come down with a cancer diagnosis and you live in a particular area, and you're one who says, you know what, I want to go to the best cancer treatment center in the United States.
Yeah.
Well, if you're on a Medicare Advantage plan, not going to be your options. But if you're on original Medicare, then you're going to have those options. And so again, if that's important, and one other thing too on the health is that you may be healthy when you get on the Advantage plan.
Right.
After you've had that Advantage plan for a year, you are not just able to go, oh, okay, I want to go back to original Medicare necessarily, because if you're on the Medicare Advantage plan for a year, then you will be subject to medical underwriting by that MedSup company. So when you want to go back to original Medicare, now the people who are covering that supplement portion of your insurance, they're going to subject you to a medical underwriting. So you're going to have to answer a series of questions about your health, about the medications that you're taking, if you've been diagnosed with something, you're not going to go back. So you just kind of remove your choices.
Right. So, and that's one thing I wanted to ask. So if you start on Medicare Advantage and then later on, let's say that you are healthy and everything is fine, and you decide you want to switch back to original Medicare. Is that you get those times of year, like October, whatever, when you can do that if they will accept you, correct?
Yes.
But it's not guaranteed.
Right.
Exactly.
And something that we haven't said is when you turn 65, it's guaranteed issue.
Right.
Whether you choose original Medicare or Medicare Advantage, it's guaranteed issue. You have no medical underwriting whatsoever. They won't ask you any medical questions.
Regardless of your health issues.
You just get it.
Guaranteed a health plan. But when you want to go, if you've been on the Medicare Advantage for over a year, then it's not guaranteed that you can go back to original.
Right. You can try and you may be able to, but you may not.
Yes.
But I want to make sure that people understand Medicare Advantages are great plans.
Yes, they are.
And you can get treated for cancer on a Medicare Advantage plan.
You can. Yeah.
Get treated for diabetes or whatever. Right. They are great plans and they cover all of the same things. It's just a few different hoops that you have to jump through. Right. And it's not, the limit. You're more limited out of state.
Yeah.
So,
right. Well, and again, your Medicare Advantage plans are going to cover you in emergency cases.
Yeah.
So if it's an emergency and you're outside of your network, because again, the Medicare Advantage plans are driven by your local networks and your doctors and things like that, whether it's an HMO or a PPO. So there's in the Advantage plan, there's your HMOs and your PPOs. And so there's some choices in there as well.
Emergency.
But back to emergency though. But if you're in another state with an Advantage plan as an emergency, then you're going to get
go to a
covered
hospital
on that,
to the ER. It's covered.
Okay. Well, that's good to know because I was kind of thinking, man, you'd be out of luck. And you still travel.
No, emergencies. Yes. You can't go to the doctor because, you have a headache.
Right.
In a different state, but
medical necessities.
Yeah.
Okay. We have covered a lot. You guys have been really helpful. Okay. Already covered all of this. Yep. Is there anything, what's the best advice you can give people who are planning on being on Medicare Original or Advantage? They're going on Medicare sometime within the next 6 months. What's the best advice you can give them?
Find an independent agent.
Yeah.
To help you.
That's kind of what I'm thinking.
And again, don't wait until your birth. You don't have to wait until your birthday month to enroll. Turning 65, you have 3 months prior to your birthday month, the month of your birthday month, and 3 months after your birthday month. That window is that you have to be able to sign up.
But you want to sign up
earlier,
as soon as you can, because your coverage will start if you sign up. 3 months before your birthday, you get it all done, everything's all worked out. Then you will have insurance coverage the day you turn 65.
Yeah, and I think that's what I did.
Later, right? If you wait later, then you may have you won't have coverage. Right. Maybe until 2 months after you turn 65. So you want to start the process as soon as you can.
And that's something I didn't realize that Robin did tell me. Let's get together. She found out when my birthday was in May. And I think we got together like in March, maybe even February, and started working on it. So that all the T's were crossed, I's were dotted by the time I actually turned 65. So it was a much smoother transition.
And I was going to cover real quick.
Go ahead.
When you turn 65, if you are still working, then and you have your work medical coverage, then you don't have to do all this Medicare stuff.
20 or more.
I mean, you still have coverage of that. Also, people who don't necessarily have to get on Medicare are people who are retired military because they have what's called TRICARE for life. So they don't have to get on Medicare. Also, people who have worked for the railroad.
Really?
Yeah. I don't know what that's called, but that's one of the companies that will insure you for life. And some government
federal employees.
Yeah, federal employees. So you don't, unless you work for, if you weren't in the military, weren't the railroad, and weren't a government employee, then you're going to need to get on Medicare.
And that's most people, but there's a pretty large segment that don't have to.
Correct. Or if you're continuing to work.
Right.
Yeah, if you're
continuing to work after 65. And that's a lot for them too.
And we'll touch on this real quick, not specific, but if you fail to enroll in Medicare when you turn 65 and you have no coverage, and then you say, 6 months later, oh, okay, I guess I decided I want to get Medicare. Well, you're going to have penalties that you will pay every month for the rest of your life.
Really?
Yes.
Yeah. It's
Yes.
important. It's important that
Yes.
you get on that.
Yes.
So
you need to, but
if I miss that 6 month period or whatever it is, and then I decide, okay, yeah, I think I want the original Medicare, I can get it, but I'm going to pay X amount extra every month. Oh
the
my
rest
gosh.
for Part B and your prescription plan Part D. It's a percentage every month forever.
So yeah, that's kind of an incentive to, yeah.
And one of the people will say, well, I don't take any meds. I don't need to get a prescription plan. Well, you don't take any meds now. So
Yeah.
an $8 prescription a month plan.
Yeah.
So that you're covered and you won't pay penalty fees later.
Well, and what I was going to say with regard to, since you mentioned prescription drugs, is on the original portion of Medicare, on that Part D, that is a standalone prescription drug plan, which means it's independent from everything else.
Yeah.
On a Medicare Advantage plan, that drug plan is wrapped into that plan.
It's rolled into everything.
So you're not paying a separate fee for that.
So let's go back though to the original. So that means with being independent, that every year, if changes are made on your medications, and now you've been prescribed by your doctor a new medication, and the current prescription plan that you have isn't really as good of a plan, you can look at your plan every year and you can change your prescription drug plan that's going to meet your needs. If you are on a Medicare Advantage plan, that drug plan is wrapped and bundled into that plan, and you're not going to have any choices about, because again, every year tiers change, the formularies change. Different things happen with that drug plan. And so every year on that, you have those choices. But under an Advantage plan, you're not going to have those.
You may change you can change to a different Advantage plan that has a prescription plan wrapped into it. So you can do it that way.
I was just thinking when Suzy, our dad, was getting older, I don't remember if he was on Medicare Advantage or original Medicare. He was ex-military. So he because he was a veteran. But anyway, I remember some of his medications were so expensive.
Oh, yeah.
Really, really expensive.
Yeah.
Well, and
I was covered.
Again, just an example, my brother had work insurance and then it was with an Advantage plan, went to Advantage plan and diagnosed with cancer. Mm-hmm. And
he had cancer before he quit working.
Yes.
And so his meds were covered through his work insurance.
Yes. And so then, because his meds were covered as his primary, because when you're still working, your work is your primary and Medicare is secondary. And, but then he retired and now he didn't have that work covering that medication. And I want to say, I don't remember if it's 8,000 or 18,000, but it was thousands and thousands of dollars for this cancer med a month.
Gosh.
And so when you're faced with those types of decisions, it's crazy to know the amount that you're going to pay for some of those. And I forgot where it's going with that, but
So kind of in summary here, and see, you guys thought we were going to have enough to talk about. We're a little over 45 minutes, so we're doing good. As you're approaching your 65th birthday, I'm trying to summarize the what they need to do. Find a licensed independent agent. Okay, go talk to them, and do not wait until your 65th birthday.
Correct.
Go
start 3 or 4 months to find that person. Mm-hmm.
Yes, that's probably the big one, and there was something else I wanted to say.
Well, again, I'm sorry. I was going to say, and if they're in your area right there, as far as Texas goes, again, we can do Texas, Florida, and Oklahoma. Right. And if they'd like to, if they're interested and they'd love for us, we'd love to help them. They can go to our website.
And I was going to ask that. How do they contact you?
Okay. SeniorsChoice65.com. SeniorsChoice65.com. And then once they're there, they can fill out the contact me form, or they can click on the phone number there and give us a call. We'd be happy to help.
And even if you're out of state, then still contact us and we can get you hooked up with somebody in your state.
You can help them find somebody near them. Yeah. So I think that's the best thing. Don't wait until the end. Correct. Get it going and find someone who is licensed. I think don't try to do this yourself. No. It's just overwhelming. There's way too many. And like I said, I wouldn't even know the questions to ask. I was like, Yeah, I guess I want that.
'Cause you can go to Medicare.gov. It's a great website, and it'll answer a lot of your questions.
Right.
You can get a book. This is
They have all kinds of them.
well, this is called
Yep, I've got
Medicare
one.
24. So this is great. I mean, it has a wealth of information. It's just a lot to wade through. And so this is same thing with the website, the Medicare.gov website.
Yes.
It's a great website, and you can look things up, but it is overwhelming.
It's a lot.
And Melissa, I was just going to say, with the licensed agent and again, yes, a licensed agent, of course, that's the only way you're going to have is a licensed agent. But again, someone that someone can vouch for, someone
has recommended.
Because there are agents just in anything, in any area that they have your business, and then they're on down the road. Someone who's going to keep checking on you, who's going to make sure everything's okay, who's going to every year they're going to check in with you and see if your needs have changed, and they're going to evaluate every year what's going on with you and if everything's okay. So
they keep track of you. And
yes, I got at that year mark or whatever this questionnaire from Robin, and at first I thought, what the heck is this? And then I realized I've got to give her this information if she's going to help me keep, she can't read my mind.
Right. Knowing your needs, if any of your needs have changed.
Yeah. I took 15 or 20 minutes, filled it out, mailed it to her. I did it. I kept putting it off, but I did get it in the time frame. So that was good. Okay. So I always give some fun facts about Waco or Central Texas. Y'all probably didn't know this. King Ranch is located in Kingsville in Texas. It is larger than the state of Rhode Island.
Oh, wow.
Does that surprise you? I mean, Texas is a big state.
Yes.
It has over 825,000 acres, home to over 200 quarter horses. Hannah would know what those are. I'm not real big on type of horse. And 35,000 heads of cattle. It reaches 6 different counties and was designated a National Historic Landmark in 1961. I have to wonder if that's still privately owned. Is
that owned by one person?
I wonder
how or a family
have to keep that place going.
Oh, tons. That's got to be an industry.
Yeah.
Yeah. Texas has 3 of the 10 most populous cities in the U.S. What do y'all think they are?
Houston.
Yep.
Austin.
Nope.
Oh.
Dallas.
Yep.
Dallas. Yeah. Dallas. Houston, Dallas.
Fort Worth.
San Antonio.
Yeah.
So the total population, well, I'm not going to go into that. I thought this was really funny. Amarillo is considered the helium capital of the world. They are the America's National Helium Reserve is in Amarillo, and it contains about 90% of the world's recoverable helium supply. Wow. And apparently, scientists initially believed that helium did not exist on Earth because they tried several times to replicate the gas, but then they find out it does, and it's all in Amarillo. So if y'all need helium, that's where you need to go.
I wonder, how helium makes you talk weird when you second.
I know.
I wonder if all the Amarillian people.
Yeah. Hey, Val, talk buddy. Yep. Who knows? Okay. So, yeah. Along with this podcast and Waco Hypnosis Center, I am available for public speaking. If y'all would like to contact me for that, my email and my website is I always have to look at it to make sure I say it right, drmelissarich.com, or email me at info@drmelissarich.com. Kim and Suzy, I thank you guys so much for being here. This was really helpful, y'all, because what y'all are doing is such a good service. People need it. It's just overwhelming. And, again, we are all getting older. So thank you guys so much. I appreciate it. I'm going to press end. It may cut us all off, or we'll just see. So I hope I will have all you listeners back again next week. Bye.
Bye.
Thanks.